COVID-19. Huge thanks to Netix, Progene and Romenko supporting me in doing this, and it's been fantastic. The feedback I've been getting, I'm really enjoying it now. It's a serious body of work, and I suppose they'll always be there on the website to go back to for people as well. If they want to, if I'm covering a topic that might be relevant at the moment. Clinical mastitis is something I'm very interested in. I know I say I'm interested in everything, but it's a significant disease, particularly of dairy cows, obviously, because it causes loss of profit and reduced performance and production. It's an area where we use antibiotics in, that we can reduce antibiotic use, which is great. Anytime we can reduce antibiotics by reducing this is fantastic. And obviously mastitis causes welfare issues because it's painful. So control of clinical mastitis is certainly some area we need to focus on more and more, because we're getting better at cell count. I suppose if I look at clinical mastitis, what is it? I mean, clinical symptoms mean they're visible clinically. When we talk about subclinical or somatic cell count, we can't see them, but clinically we see mastitis. There's 3 levels of change. One, simply the milk consistency will change. You might have a very sick cow. The second one is milk, and the udder can be quite inflamed, so it's still a local response even though it's quite severe. And the third one is where the milk, the udder, and the cow cow is actually sick with it. You look at E. coli mastitis and toxic mastitis as good examples of that. So there's varying degrees of severity. There's a number of bacteria, and I'll talk about that can affect it. What I did with clinical mastitis, I'm going to try and do with everything, is trying to break it down as simple as possible. So if I understand the simple mechanisms, I'll be able to understand how maybe you might find out a better idea of how to control it. So when I think about clinical mastitis, I think about 3 levels. First, the amount of infection pressure, which is really the volume of bacteria, particularly pathogenic bacteria, that the teat is exposed to and the udder is exposed to. Then number 2 is the teat function. That's the physical gap or the gate going into the udder, and then the third important one is the immunity of the animal itself in the udder, or even at third level you can do these 3 things. So immunity is key. So most bacteria get in there, and a healthy immune system will control them. We won't see anything, we won't know that anything's happened inside that udder. But if you've any compromise in any of these 3 levels, you can have real problems. So I have a training program, other things, where I look at all types of clinical mastitis, and really it's about risk assessing each of the steps for the various types of mastitis, and it is other things, it's things outside the udder, particularly with clinical mastitis, that you look at step by step and how can you make improvements, risk assessment that way. So if I look at these 3 things, the environment, the environment that the cow or the teat in particular is in, the more bacteria that's there, the more challenge that's there. And if we look at, this clinical mastitis is often referred to as environmental mastitis. And if we look at, where are the cows, how dirty is the teats, how dirty are the cows, how dirty is the belly, this can all help us assess, is there something we can do? Can we run scrapers more? Can we get more fresh air into this shed? How often do we lime, or how often do we disinfect cubicles? What's milking yards like? It allows a step-by-step approach, and that's basically what I do. I just go through step by step all the areas in the farm that may be contributing, and then I look at the ones that can be most, I suppose, that you get the best response for. And I think that's, when we look for the solution for mastitis in particular in a tube or an antibiotic tube, it's a very short-term fix, but it's a whole systematic approach that's key to it. Then if I look at the next, so that's the environmental assessment. I suppose just quickly on that, if we look at infection pressure challenge, the routine becomes very important, milking routine. And if we think about this bacteria getting into the udder, if we can look at pre-dipping or pre-foaming as a way of controlling the amount of bacteria on the teat at milking time or before milking, that's very, very useful. While post-teat disinfection tends to control the spread of mastitis in the parlour, pre-dipping is controlling the environmental pathogens coming in. So if anyone has an issue with clinical mastitis, don't have time to get out and do an assessment, the first thing I'll say is, are you pre-dipping? You should start until this mastitis problem comes under control as part of it. And the routine, if you think about the udder prep itself, if the cow comes in, she has a period where that calf would be butting her normally to allow milk letdown, relaxation, get those alveoli producing the milk, let that milk letdown. So prepping the udder pre-milking is really important. That was a tongue twister. But the other thing is force stripping, so checking each quarter, because what that will allow us to do, particularly if you're getting a run of clinical mastitis, we must be doing, it's a legal requirement, but you must be doing it, because we'll miss 50% of clinical mastitis if we're not stripping udders. And then it's about either pre-spraying or pre-foaming. And I spoke to Progene have a product called Pre-Gold. I spoke to the vet who actually designed the product fantastic scientists. We did a massive conversation around this whole area idea of and the science behind it of the product. We really focused on the importance of hygiene in clinical mastitis. And I think it's really important. So the environment, and that's where pre-dips fit in, is they help reduce, by a short-acting agent that will kill bacteria on the teeth, reduce the exposure. I suppose number two, if you go past the environment, number two is teeth function. This mechanical gait, these important muscles at the bottom of the teeth sphincter, which open and close. They're open during milking. And we must remember, our cow milk flow rate has almost doubled in the last 30 years. So the pressure that this gate is under is increasing. So teeth function is really important. If you're looking at things that affect teeth function, first of all you have to look at the end of the orifice to see if there's protrusion or damage to the teeth of cows, or at third level, what role is machine and vacuum playing on that. It's an important thing to look at. And then we can look at diseases like milk fever. Actually, milk fever can play a role on teeth and immunity. But if you look at teeth, milk fever is low blood calcium, so anything that affects muscle function will weaken that teeth. Can be a cause of issues where you see a spike. I have seen this, a spike in E. coli mastitis or toxic mastitis, where milk fever is involved in teeth function being reduced, and also it plays a role in immunity, particularly in neutrophils, which may play a role in the reduction and control of clinical mastitis. So that's teeth function. So the environment, teeth function. And number three, really important one with clinical mastitis, I think, is immunity. So the immunity, like there is bacteria in the environment in farms, they do get into the udder, but if we've compromised the immune system, that's where we see a lot of the clinical issues. And the more severe the compromise of the immune system, the more severe often the mastitis is. So stress, I think, is actually quite a big one. Disease, minerals, parasites, nutritional stress in animals, particularly around transitioning. That's where we see most of our clinical mastitis. And we talk about targets for clinical mastitis. We see most of our clinical mastitis in the first 30 days after calving. That's quite an immune drop. Cows are more prone. They're starting in the milking routine. So that's why we need to be most vigilant in freshly calved cows. If you want to look at targets, it's 8 cases per 100 cows in the first 30 days, and 25 cases per 100 cows over the year is your target for clinical mastitis. We'll talk about that. So obviously it's good to get an idea of what cultures what actually samples we need to take to find out what bacteria are there. Now a lot of times people get frustrated because we say, oh well, I haven't got anything back on the milk sample, didn't get a bacteria, but that might mean that the immune system has actually done its job and actually there's no bacteria left. So some of the clinical symptoms we see or signs we see in the milk are actually post. It's like when the robber been in the house, it's the damage is done after, and that's what we're seeing. But it's still very, very good from a culture perspective to see what bacteria are there. It allows us to make better decisions around treatments, because we will need to use antibiotic treatments on some of these cases and see what actually pathogens are there. It might feed into our idea of how it's spreading as well. So like for strep uberis, for example, that can spread from the environment, but it also can then become a contagious mastitis. So it's really important to get cultures. Then we look at treatments, and the most important thing I say, and we don't do this enough, is monitor treatments. Look at how effective treatments are, review them, again, because some of them will involve antibiotics. Really important to evaluate the treatment decisions. I think one product we don't use enough in clinical mastitis, because mastitis is inflammation of the udder, is anti-inflammatories. Really, really help with mastitis. Anti-inflammatory medication, and depending on the severity of the mastitis, supportive treatment. So if you look at E. coli mastitis and toxic mastitis, if you do not give supportive treatment like fluids and pretty intensive fluid therapy to these cases, you get very poor treatment outcomes. Okay, so that's it. I think I've covered all my bases there on clinical mastitis. I suppose a very key thing, it's very controllable. We need to break it down to simple steps, and then it gets more involved. But really, if you think about it, the amount of infection pressure, a good functioning teeth and healthy immune system, if there's a breakdown and you get a spike in it, something has happened here. Often it's in the immunity piece, can be the teeth, and then we can work on the environment as well, and that's clinical mastitis. Okay, thought for the day today. I've been reading a lot over the weekend about what might be happening in the future with all the changes and challenges that are coming down the line. And I think whatever will evolve out of this situation with coronavirus, we're going to be in probably a very different world. And I think those who are willing to accept the changes coming, and changes will happen, and adapt to them will be the strongest. normality as we know it will probably never be the same again. And I think that's when it comes to change, any kind of change makes us uncomfortable. But, you know, embracing change, even though in extreme circumstances like this, uncomfortable circumstances, this can be very hard, it is inevitable. The better you are at adapting to change, the better you are at adapting in general. That's my thought for today. Happy safe farming, everyone.